Hey everyone, this is Corey coming to you from Blogger 12. I am here in the Rosacea Facts Suite with Dr. Hillary Baldwin. I'm very excited to be doing this great interview and help my readers become more aware of rosacea and possible ways to help stop embarrassing yourself in public. So, I know I personally have been suffering from rosacea, and my students, I am a teacher professionally, my students laugh at me all the time when I start turning red. And what would you say, what would you tell people to say if they're being embarrassed? And it is a medical condition, it's not something that can be helped. So.
Right. Well, you know, as you mentioned, a lot of rosacea is the flushing and the blushing, right? Blushing occurs because you've become embarrassed. Flushing just happens, right? So you're just standing there and all of a sudden you feel yourself get very hot and very red, and there's nothing you can do about it. In fact, the more you worry about it, the worse it gets, right? You flush and you say, oh crap, I'm flushing, and I don't want to, and you get anxious and therefore you flush even more. So, you know, if it really bothers you, we don't have good pharmacologic therapy for it yet. We don't have topicals or orals that work well. Right at the present time, we're dealing mostly with laser and light therapy to get rid of the redness. But right now, really all we have to offer for you is to cover it up with concealer so that you don't see it when you flush underneath it, which is uncomfortable, especially in the summer. So, you know, I personally I think rosy cheeks looks good. I mean, that's why nobody ever says rosy cheeks are unpleasant. I mean, it's a nice, healthy, beautiful look. So hopefully you can ignore people when they're rude like that. But you know, if you can't, unfortunately, at the present time, all you can do is cover it up with makeup.
Now, like you were saying with the makeups, there are so many companies and stores out there that sell these makeups. Do any of them work better than others, or is it all just a bunch of marketing and you gotta just go with what feels right?
Well, I would suggest you go with what feels right, because there's an awful lot of marketing out there, as you say. But there are products, for example, that are going to be a little bit more irritating for rosacea-prone skin. Lots of people with rosacea complain of having a lot of stinging and burning and very sensitive skin. So you want to cover the redness with makeup, but the makeup might actually make your irritation worse, right? So how are you going to deal with that?
I personally use baby sunscreen because even the ones for sensitive skin do make my cheeks burn. And I used to be teased for that too because I couldn't borrow everyone's sunscreens. Right. You brought up the flushing and the blushing. So let me ask, how do you know if you're just blushing or if you have rosacea? Is there a way to know without seeing a doctor? Or, well, obviously you do want to be correctly diagnosed.
Right.
But is there a way to know if it's something serious enough to see a doctor about?
Well, ordinary blushing, I say something that embarrasses you and you turn red, is clearly a normal emotional response to an embarrassing situation. But flushing, just sitting there all by yourself with nothing on your mind and all of a sudden, right, sort of like a hot flash that menopausal women like me experience. Out of the blue, all of a sudden you get hot and red. So that's something that you would probably want to get evaluated. There are diseases that cause flushing. They're very rare, but there are conditions that can cause flushing, along with some shortness of breath, for example, or diarrhea. That's a time when you need to get checked out.
Okay. Now something else, I don't know if my readers, as I said, I don't know if any of them suffer from rosacea, but it does affect more than just your face. So what else, besides the blushing and the flushing, what other symptoms might people see if they have rosacea?
Well, you can have pimples on your face that look very much like acne, but they're mostly here in the center of the face. There's no blackheads. There's no involvement in the chest and the back and the arms where there is in acne. You can actually have enlargement of the sebaceous glands in your nose and your chin and your cheeks, and actually end up with a big sort of W.C. Fields nose. The good news is that it only happens to guys. It almost never happens in women. And you can also have involvement of the eyes. You can have some redness on the rim of your eye or redness inside your eye and the whites of your eye, and feeling of grittiness like sand blew into your eyes, and maybe a lot of junk in your eyes in the morning. And all of those can be rosacea.
Okay. Like I said before, most of my readers are in their 20s, maybe 30s. What would you say to them about rosacea? Like, what is something you you wish you had known when you were 20-something? Because I know you're about, what,
Right.
33 now?
Yeah, exactly, yeah. Times two. What I wish I had known. I think I did have rosacea when I was younger. I certainly had moments when my face was very red, and people would say to me, they wouldn't make fun of me particularly, but they would say, "Why is your face so red?" You know, and I just thought it was me. I thought it was normal. I thought it was just part of life. My mother had rosy cheeks too. I wish I had realized that it was a condition that was potentially treatable. So I would say, you know, make sure you get yourself to a dermatologist, get an adequate diagnosis, and then pursue a treatment to make you feel better about yourself. You know, that's the problem. Rosacea patients, 16 million people out there with low self-esteem, not wanting to go out, turning down a date because they're red. I mean, life is too short for this sort of thing. So get treatment.
Is there anything else that you would want them to know, to my readers?
Triggers. We didn't talk about triggers. There are some triggers. Some people have specific things that make them turn red or make them get pimples.
I know for me, spicy food does it.
Spicy foods are on the top of the list. Red wine, chocolate, hot beverages sometimes, coffee and tea, hard cheese. Did I say that already?
You just cut out my entire diet.
I know. All the things that are interesting in life, right? Cocoa powder of any sort, so it's not just chocolate, hot chocolate and things like that. But everybody's triggered by something different, and a lot of people are triggered by sun, right? Now, sometimes it's the heat of the sun, not much you can do about that. But if it's sun itself, sunscreen, right? Something as simple as that might actually be able to calm it down. I find that when my flushing starts to occur, that sucking on an ice cube is very helpful as well.
I like that idea.
Right, so just pop an ice cube in your mouth and just hold it there, and it can reduce the redness and stop the cycle of, oh gosh, I'm about to flush. Please don't happen now. Don't happen now, don't happen now, I'm getting worse,
So
right?
it's kind of like yoga in a sense. You're
Right.
relaxing yourself.
Yes.
So you're not aggravating the stress levels.
Right, and we don't know why people get red with rosacea, but part of it is a misfiring of the brain. The brain thinks that you're hot and needs to cool you off, so it dilates your blood vessels. So if you put the ice cube in your mouth and you say to your brain, no, I'm not hot, I'm actually cold, maybe it shuts the whole thing down.
That's really interesting. Dr. Baldwin, thank you so much.
My pleasure.
I'm really glad that I got this opportunity to speak with you.
Thank you.
If any of my readers have any other questions, you can hashtag rosaceafacts and hopefully someone can help you.